Okay, thank you for that introduction, Sue. It's very kind of you, and it's nice to see you again after a long time, and it's nice to see Denise, of course. So this evening we're going to look at using acupressure for pregnancy birth, and particularly the use of combs during labour. Like Sue said, acupressure is not necessarily new, but it's certainly new to some midwives, and it's certainly new to some of the women who come to visit me in clinic. And we talk about these things when we discuss acupuncture. So, acupressure is rooted in traditional Chinese medicine. And we might be more familiar with acupuncture, where we're using needles to stimulate acupuncture points, sometimes called acupoints or acustimulation points. But acupressure is, as I said, rooted in traditional Chinese medicine. And the theory behind that is that we have a number of channels or meridian lines, energy lines, which formulate around the body, which are connected to each organ of the body. And the theory in T7 theory is we have this energy, this chi, which circulates around the system and maintains a homeostatic or a yin yang theory balance, and it makes us in a healthy state. So we maintain a healthy state. However, if the energy becomes blocked, or we have too much, we have an excess in energy, or we have too little, a deficient in energy, then we can create an imbalance in the system. But basically, acupuncture, or in the form of acupressure, which involves applying pressure to specific acupuncture points along the body rather than inserting needles, plays a vital role promoting balance, relaxation, and healing. So there are many benefits by using acupressure during pregnancy. It can first of all involve the birthing partner, which during labour can give the birthing partner some autonomy, something for the partner to do, something to focus on. We can teach in an antenatal education, which we often do. We teach it to midwives through the expectancy programs. I teach it to couples in my private practice. We can use it for a number of conditions during pregnancy, such as nausea and vomiting, birth preparation, encouraging labour, post-dates pregnancy. And we can learn these techniques at home. So the women in the couples can go home and practice these techniques in preparation for labour. It's also non-invasive, and it's very easily for midwives to be trained. We don't need to be a qualified acupuncturist. We don't need really to have a necessary understanding of the physiology and anatomy of the body. It's very easy to teach. It's a safe technique. It can be very effective, and it's accessible. And I find that most women do like to have that autonomy, so they can start at home to work with some of the acupressure and then continue with it up until birth, due dates, or even into the post-dates period. So they're usually very compliant with using acupressure too. And it can be quite an experience for the couples to get together and practice these techniques. It's also very commonly used for pain relief. So it stimulates the release of endorphins, such as the body's natural painkillers, which helps ease discomfort during labour, during contractions, which in turn can support and promote a more positive birthing experience. It can help to reduce anxiety and tension, again by using gentle pressure on the acupoints. It can calm the nervous system, allowing the body to work in a harmonious state. It's also been shown to enhance uterine contractions. So specific points encouraged to apply pressure can encourage uterine activity, promoting efficient contractions, which is something which we always look for in promoting a positive labour or a positive pregnancy outcomes. And research has shown, so there is some research out there, it's shown that it can shorten labour and promote normal vaginal births, which is always a bonus when we're looking to promoting the normal physiological onset of labour or a normal vaginal delivery. It can shorten the time between the expected date of the delivery and the actual time of delivery. So that's also noted in the research. It's reported that women use less analgesia for pain relief in labour, and also it enhances and supports cervical ripening. So these are some of the benefits we use through general acupressure, sorry. So very often when I'm teaching the couples, which I see in clinic, they either ask what the comb technique is. In fact, when I was teaching last week, I was teaching midwives last week for the expectancy program. A couple of the women, actually, one of the midwives specifically, asked me about the comb technique. I did guide her to the maternity midwifery hour this evening, but yeah, so we do get asked about it. I think there are some combs which are left in labour wardrooms up and down the country, so it has become more common knowledge. So what is the comb technique? It's basically a non-invasive method which we can use the comb during labour to provide pain relief and promote relaxation. All we need is a comb, and I know you might not see this quite clearly at the moment, but this is a curved comb. Now, out in the market at the moment, there are lots and lots of different types of comb which are being produced. This is still quite a large comb, but initially the theory began and the thought behind it began with just using a normal straight comb, which I used to actually use in hairdressing, one of the other things I used to do many years ago when I'm cutting hair. So we used to use straight combs, and a straight cutting comb just as easy. But then since the technique has become more popular, there are more of these curved combs being manufactured and used for labour. So how does it work? So during a contraction or during an experience of any discomfort, we actually hold the comb with the teeth. I don't know whether you'll be able to see this quite clearly, but I can show you off screen in a second. But we can hold the comb with the teeth against the skin in the palm of the hand. So by gripping the comb, which applies pressure to the acupuncture points on the palm of the hand, because we do have acupuncture points all over the body and specific ones in the palm of the hand, it stimulates and activates the nerve pathways, which diverts attention away from the pain signals. So in other words, by using the comb technique and squeezing this into the palm of the hand, it's creating distraction away from the pain in labour. So a guy called Ronald Melzack, his theory of the gating signal suggests that pain can only focus on a few sensations at one time. So therefore, if we're focusing on squeezing the comb rather than squeezing a partner's hand, we're squeezing the comb into the palm of the hand, it's distracting us from the labour pain. And it aligns with the gate theory of pain, but providing non-painful sensory input, such as a comb pressure, it closes the pain gate, reducing the perception of pain. So the activation distracts the brain from the pain signals, providing relief. So that's the gate pain theory. It's interesting to note also in relation to acupressure points that the acupressure point stimulated by using the comb are two separate acupressure points on the hand. One is called pericardium 8, which is in Chinese, we refer to that as being Lao Gong. And this sits in the center of the palm of the hand. When the fist is clenched, where the middle finger rests, that is pericardium 8. It's also known as the palace of toil, meaning hard work, especially in labour. Gong meaning palace, and Lao meaning labour or toil. The other acupressure point, which is activated when we're squeezing the comb, is a point called heart 8. And when a fist is made, this point actually sits where the tip of the little finger rests. So it's interesting to note that both pericardium 8 and heart 8 are commonly used acupuncture points used to ease anxiety and calm in traditional Chinese medicine. So there's two things there. It's activating acupressure points, and it's also acting as a distraction and creating the activating the pain gate theory. To summarize really the comb technique, it's a way of using a natural pain relief or activating to use for natural pain relief in labour. The comb stimulates endorphin release and eases discomfort during contractions. It can calm relaxation. These are all things which we want in a midwifery setting, in a labour setting, to calm the women, to help calm the women. I actually teach these acupressure sessions to couples and sometimes in groups. So again, it's great for teaching antenatal education. It calms the nervous system, reduces anxiety and the tension, providing efficient uterine contractions. It's very easy to learn. It's very, very accessible. The women tend to comply with this quite easily. You know, we're not going to be using needles and giving needles to women or to the partners to needle them while they're in labour. So the comb technique is a really great technique to use. And remember, the comb technique can also be used during medical intervention. So if a woman is going for an induction of labour, for example, this is a great tool to just to put into the labour bag really, and to provide hands-on support during labour. I think it's also important to mention that it's important to consult a certified practitioner to learn the technique and to identify the correct acupressure points. There are acupressure points which should be avoided during pregnancy. However, we're talking now at term and going to labour, so not so much really. And while there is research is ongoing in relation to acupressure, it may be necessary to look at the research around acupuncture to just have a look at what points are being activated when we're using needles, which are going to be the same points, similarly, which we activate during acupressure. So again, I think it's worth to mention that everybody has a different pain threshold. Everybody's experiences of pain can vary, and it can be varied depending on their perception of pain, and also in relation to how stressed they are, how anxious they are, can all have an effect on the brain and create different pain thresholds in different women. So I think that almost brings us to the end of a little brief presentation as an introduction to using combs. So if anybody would like any further information, my email address is there and my website address is there, so people can contact me if they wish. I'd also like to just signpost midwives to Expectancy Certificate in Midwifery Acupuncture, which is a programme which we've run now for, I think, coming up about 10 years maybe. And Denise is nodding, it says 10 years. It seems forever. We've been teaching these programs. We've taught some amazing midwives. But what we do in that program, we do teach quite a number of acupuncture points actually to use to teach midwives to use acupuncture throughout pregnancy. So from the antenatal period, the intrapartum period, into the postnatal period. Expectancy also offer an online post-dates pregnancy training day, which again is aimed at post-dates pregnancy. But within that session, which I teach also, within that session, we teach acupressure points to encourage labour, which is another session which we perhaps can talk about, which specific points we can use for labour specifically. Again, in relation to helping the baby move further down into the pelvis, pain relief in labour, and anxiety. I personally teach within my private practice. I teach 9 or 10 acupressure points to my clients and to their partners to enhance their labour and birth experience.